Hello, my name is Elisa Hernandez Lusk, and I will be performing a head to abdomen exam on my patient Bella for my pediatric nurse practitioner course and for advanced health assessment. I am going to now wash my hands. I have obtained Bella's vital signs, and her blood pressure is currently 103/62 with a pulse of 74. Her respiratory rate is 22. Her temperature is 98.7. Her current weight is 140 pounds, which places her in the 95th percentile, and her height is 63 inches, which places her in the 95th percentile as well. Hello, Bella. How are you doing today?
I'm doing good.
Good. How old are you?
I'm 12 years old.
And what grade are you in?
I'm in 6th grade.
And where are you?
I'm in the kitchen doing a physical assessment.
Very good. So I have done a neurological exam on Bella, and she is alert and aware of her surroundings. Her speech is clear. Her posture is good. She is calm at this time. There is no physical distress seen at this time. I am doing an overall general exam of Bella. Her hair is well distributed. She is well dressed for this exam. There is no visible lesions, bruises, or abrasions on her face. Her eyes are symmetrical and her nose is midline. I will begin by assessing Bella's head for symmetry, any lumps or bumps or any lesions. So currently her head is symmetrical. There are no visible lesions or infestations noted on her scalp. I will now assess her frontal sinuses for tenderness and her maxillary sinuses for tenderness. Bella, when I touch those areas, do you feel any pain, any discomfort?
No.
Very good. I will now move and assess Bella's eyes. Currently, her eyes are symmetrical. There is no drainage noted. There is no swelling noted, no edema seen. Her sclera is nice and white. There is no yellow color noted to her eyes. I will also assess Bella's visual field and her eyes for accommodation and pupillary reflexes. I'm going to cut the light for 1 second. Okay, Bella, can you please cover one eye? Very good. And can you tell me when you see my fingers?
No. 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 No.
Very good. Can you cover the other eye, please?
No. 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 No.
Very good. Now, Bella, can you keep your head still and only move your eyes where my fingers go? Very good. Now I will assess Bella's eyes and assess for her red reflexes and for her fundus using my ophthalmoscope. Very good. I will now assess her pupillary reflexes for accommodation. Very good. And her funduses are seen bilaterally, her red reflexes are seen bilaterally, and her pupillary reflexes are intact. I will now assess Bella's ears. First, I will start off inspecting Bella's ears. I will palpate her pinna and her lobe for any nodules, any lumps, any tenderness in her lobes, any tenderness in her tracheus. Her external auditory canal is patent. Bilaterally, I will begin by inspecting her tympanic membrane. using my ophthalmoscope. I will begin with her right ear. And her tympanic membrane is a pearly gray. There is no signs of cerumen or debris. And her corneal light reflex is seen at 5 o'clock. I will now inspect her left ear. And her left ear, tympanic membrane is intact. There is no visible debris or any redness. And her tympanic membrane is seen at 7 o'clock. I will now perform the whisper test to assess cranial nerve number 8. So Bella, tell me what you hear.
3.
Very good.
2.
Very good. I have assessed cranial nerve number 8 and it is very intact. I will now assess Bella's nose and it is symmetrical and midline to her face. There is no drainage noted at this time. I will begin to assess cranial nerve number 1. Okay, Bella, I will assess her nares for patency. Can you please close one nose and take a breath? Very good. Can you please close the other nose and take a breath? Very good. Now can you please close your eyes for me? And can you tell me what you smell?
Coffee.
Very good.
Lemon.
Very good. Now can you lift your head for me? I am looking in her nares. There is no polyps noted or any bogginess. Her membranes are nice and pink. There is no drainage noted. And cranial nerve number 1 is intact. Now Bella, can you close your eyes for me and tell me when you feel me touching you?
Yes. 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 Yes.
Very good. Now can you open your eyes wide? Can you raise your eyebrows? Can you puff out your cheeks? Can you frown? Can you give me a big smile? Very good. Now, can you clench your jaws? Very good. And can you move your jaw from side to side? Can you open your mouth and move your jaw from side to side? Very good. I have assessed cranial nerve numbers 5 and 7, and they are all intact. I will now inspect Bella's mouth. And right now, her mouth is nice and pink. There are no visible dryness or lesions or cracks on her lips. I'm going to inspect in her mouth. Bella, can you open your mouth for me? Very good. And her mucous membranes are nice and pink. Her hard and soft palate are intact. There are no visible lesions or any exudate, and she has no missing teeth or any dental caries right now. Can you stick out your tongue for me? And can you say ow? Very good. Her tonsils are at a grade 2. Her uvula is present. Can you lift your tongue for me? Very good. And I've assessed cranial nerve number 9, 10, and 12. I am now going to inspect Bella's neck region for any lumps or any masses. And I will also be assessing her lymph nodes. Currently, her neck area has no visible bruises or scarring noted. I will begin with the preauricular node, postauricular, occipital, posterior cervical, anterior cervical, submandibular, submental, supraclavicular. I am assessing her neck for any masses or lumps, and there is none noted. I'm palpating her trachea, which is midline. I will now palpate her thyroid, and it is not enlarged and intact. Okay, Bella, can you shrug your shoulders for me? Very good. Now can you put your shoulders down? Now can you shrug your shoulders again against my resistance? Very good. Now can you turn your neck to the left? And now turn to the right. Very good. Can you press your head against my hand? And can you press your head against my hand here? Can you put your neck down and put your neck back? Very good. And I've assessed cranial nerve number 11, and that is also intact. I will now assess Bella's range of motion. I will first inspect her skin on her upper extremities. They are free from any scarring, any bruising, any open lesions are not present. Her skin looks well. I am going to palpate for any tenderness. There are no deformities noted at this time. I do not feel any crepitus in her clavicle area or in her shoulders. I will now assess her brachial pulses, and they are present bilaterally, and her radial pulses are present bilaterally. Her fingers are not clubbed. Her capillary refills are less than 3 seconds. There is no swelling noted. Is there any pain when I touch on you, Bella?
No.
Very good. Now can you lift your arms up for me to the sky? Very good. Now can you bring them down and off to the side and to your side? Can you bend at the elbow? Can you put your palms down and put your palms up? Can you make a fist for me? Can you turn your wrists? Can you put up your wrists? Can you splay your fingers? Very good. Now I will assess Bella's bicep reflex. And her bicep reflex is intact. I will now assess Bella's lung fields. And I am currently visually inspecting Bella's work of breathing. Her work of breathing is good. She does not appear to be in any distress. She does not have any nasal flaring. She does not have any circumoral cyanosis present. I will now assess her lung fields anteriorly. And take a deep breath. Deep breath. Deep breath. Deep breath. Now can you put your hands to your waist? Deep breath. Deep breath. Very good. Her lungs fields are nice and clear anteriorly. There are no signs of any adventitious breath sounds currently. I will now assess Bella's lung fields posteriorly. Can you turn for me, Bella, to the side? Thank you. I'm also assessing, again, her work of breathing. She does not appear to be in any distress at this moment. I'm going to assess her breath sounds posteriorly in a systematic fashion. Deep breath. 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 Very good. I am now going to percuss Bella's posterior area and assess for any dullness, any air, or any fluid that could be in her lungs. Very good. I'm also going to assess Bella's breathe-in and assess for symmetry. Okay, Bella, take a deep breath and blow it out. One more deep breath and blow it out. Very good. Can you turn around for me? I will now assess Bella's heart, and I will listen for any murmurs. I will listen for her rate and her rhythm of her heart, and to assess if there's any extra beats noted on her heart. I will use my diaphragm first, and then I will repeat the process again using the bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. I will again repeat it using the bell portion of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, mitral. On auscultation, there is no murmur present. Her rate and rhythm are appropriate and good. There is no extra beat that was heard on auscultation. I will now assess Bella's chest area for any rashes, lumps, or bumps, and I will also do my abdominal assessment on Bella. Bella, can you please lay down for me? I am now doing an inspection of her chest area. There is no rashes noted. There is no lumps or bumps, any abrasions noted. I will now palpate her chest area for any lumps and any bumps in this area. I will do a breast exam, but for school purposes, this exam will currently not be done. But if it was a physical exam, a breast exam would be done on an age of like Bella's. I will now move towards the abdominal region of her abdomen, and I will visually inspect for any lumps, bumps, any masses, anything protuberant. I will now listen for her bowel sounds, and I will palpate for any bumps or any lumps on palpation. So Bella's abdomen is free from any rashes. Her work of breathing is done well. I will now listen to her bowel sounds in all 4 quadrants. So Bella has very good active bowel sounds, She does not have any hypoactive bowel sounds heard on auscultation. I will now palpate her abdominal area for any tenderness or any bumps or any masses. And so I am currently doing a light palpation. And now I will do a deep palpation. Do you feel any pain or tenderness in that area, Bella?
No.
Okay. So there are no lumps or bumps felt on palpation with light or deep palpation. Okay, Bella, let's sit up. And that concludes our head to abdomen physical exam. Thank you.